Good morning. So, having set your clinic and sitting calmly may not serve your purpose. You have to have good number of patients. You have to be. It should be very good. Other number of patients your clinic. So, how to increase your footfalls? Basically, this talk is a little bit over what I've been already told, and it's prepared for beginners basically. So, the ABCD of practice is first point is availability. It is the topmost. If you're not available in the clinic, it's you taking too long vacations or attending too many conferences also. Beware of this. So your practice may suffer, especially initially you have to be at your clinic, and if you're not there, even your most loyal patients can go to other doctors. So you have to be very sure about that. Second is the behavior. Your behavior has to be very gentle. Your staff behavior should be very good. They should be courteous. You have already mentioned that your reception should be very good, and anybody who's taking your reception calls at phone calls should have adequate telephone etiquettes. And third comes the competence. You can see some of the very talented eye surgeons are not having a good practice, but some of the mediocre surgeons have good practice. The reason is the above two. His behavior was very good. If the doctor is very competent, behavior is not good, he is not available, then his practice may not click. Third is the delegation. It comes later. Once you started your practice, naturally you have to increase your things, and as a solo person you can't do everything. Then you have to delegate to your staff. You have to train them. They may be trained from good centers, they may not be trained from good centers, but you have to give your personal opinion. What do you want from your staff? You have to teach them, and it's a constant process. It's not a day when you teach them, it's okay. They got a training, it's okay. You have to upgrade, you have to have a liaison with your all staff, and it should work like a team. So to delegate, that means if you're having other ophthalmic assistants, you are having doctors, you have to make a team for that, and team is going to win what has been already told to you. Now utilizing the things like social media. The number one is brand building. Whatever name you are giving, your hospital should be known by that, and you have to build a brand. See in our India, there are different hospitals. They have got names like, if you talk of Apollo, you don't talk of doctor, you talk of Max, you don't talk of much of doctor, but you talk of hospital. They have a good brand in there. You have a Center for Sight or other solo practitioners, they've got a brand like this. So you have to enhance your brand imaging. That's very, very important, and brand is going to pay. If you want to delegate your work, it's a little work. So everybody, if coming to you directly, that means you're promoting yourself. But don't promote yourself, promote your hospital. That is the most important thing. Second, press and TV. Already have been said, we have to be very careful about giving ads in press. It have an impact. But considering the MCI, considering the other things, you have to be very sure about the insertion of your ads. It should be a surrogate ad. It may be in a good taste. That's very important. Don't demean your colleagues or saying something like, we are the best, we are much superior to others. This will put in a world of wars, and ultimately you both may be loser, or you all may be loser. So be sure that you are going in an advertisement that should be in a good taste. That should not be hyper sort of things. It should gently say what are the positive points you have on others. So articles public, you can write the newspapers saying about the glaucoma, say about the night blindness, say about the cataract, these about the child screening, these things can be easily covered, and you press people will cover. And I tell you, the press news carries more authenticity than any advertisement. So it's better to give your news. It's indirect publicity, but it's going to help you a lot. So on TV you can have interviews and ask talk on the different topics. This is a very good forum. Then in the Facebook, you can have a good Facebook site. You can get response from your hospital Facebook also, and it's going to cover a lot of persons. Then you should have a good website. That's very important. That's been already stressed. Now most of the younger generation, they are going to see your website first, then they are going to know about your hospital. So if you want to have referral from different places, then your website should be very good. Then we have got different apps. You can have an app for your hospital also. We are going to have appointment. We are going to schedule all the things. and then SMS, email campaign. These are not very important, but you can have all these things to add your practice. Then conferences. Just already has been mentioned, you have to give talks in IMA, you have to talk to doctors personally also, person sitting in the practice, and public talk also, like Lions Club, like Rotary Club, you can go there and talk to a public problem. That's going to give a very good boost to your image also and your hospital also. Then camps, you can have a medical camp, you can have a surgical camp. They are both equally effective, and it helps to build your brand, it helps to increase your practice also. But surgical camp, make sure you have to do it in your hospital. And if you're going to do medical camps, try to make them patient to come to your hospital for subsequent visits. Give a free visit for another 10-15 days. Then they'll come to your hospital and they know about the hospital. It's very good in the beginning especially. Then school screening is another good program. You can adopt a school, send your team to there, they can screen the children, and you'll be surprised to see how many children are having visual problems. Then PRO has already been mentioned, that a public relation officer you can't go and meet every doctor. Your public relation officer can go and meet the doctors, meet the pharmacist also, and he can do job for you also. Then press availability cover, we have to be very ethical. MCI has given a guidelines, we have to follow that, and it should be in good taste. On TV, you can have interviews, you can have programs, but direct advertisement is not very good, supposed to be very good. Then you have other things like advertisement on Facebook, other sites, Just Dial, virtual phone, and virtual secretary is going to help you a lot. You can have virtual phone where your call will be received by a caller from the professional one, and that will be referred to your centers, and you can have all the records. You can have all the audio records also, and you can analyze what's happening in your hospital, how your reception is receiving the calls. Then insurance and TPA, this is another area where you can increase your practice. So get empanelment from the TPA. It's a bit tricky, but you have to get and see how they work. And you can get good number of patients. Now this health coverage is increasing in India. Most of the, now good number of person are having medical insurance. Some of the company employees, they're having medical insurance. So naturally they have to go to authorized doctors only. So try to get empanelment from the TPAs as much as you can. Then online and physical documents, paperwork, this is important, because if you're going to for this thing, if you have good number of insurance patients, then you have to have staff who can handle all the paperwork also. Then other authorization like CGHS, it's again a very important one, because once you get authorized for CGHS, most of the government departments recognize you and automatically puts you on authorized hospital list. So if you can get a CGHS empanelment, that's going to help you a lot. Then you have ECHS, that's concerned with ex-army service persons. Then most of the central government departments, they follow the CGHS rates and CGHS authorization also. Then you can get registered with state government departments. You can know what are the state government departments which offer these facilities, maybe cashless, maybe on payment also. Then corporates, you can tie up with them also. So this is in a nutshell what I want to say. Thank you very much.